And now we will be preparing a medication that is inside a vial and which will be administered to the patient. Right now, as you can see, the nurse is trying to verify everything that is seen in the ticket as well as in the medication administration record. She makes sure that the medication is not expired, and she look into the medication administration record to make sure that the medication on hand, the ticket, as well as the one which is written in the MAR is matched or are matched. Right after she was able to verify everything in the MAR, she makes sure to get the 10cc syringe and incorporate the sterile water for injection to the medication. And as you can see, she removes the tap of the vial and considering a new sterile water for injection. If you do not have any sterile water for injection, you can use a plain NSS or a normal saline solution in a carpio. She has to make sure that the needle is well in place, and as you can see, it should be in the eye level, making it sure that she thoroughly aspirate the sterile water for injection from the carpio. Sometimes you have to be patient in terms of withdrawing the sterile water for injection in the carpio because it would really take long. Right now, as you can see, preparing a piperacillin plus tazobactam or piptaz, which is 4.5, needs to have at least 20 cc of plain NSS or sterile water for injection that you need to incorporate. And this is what you call a technique that you have to consider as well. As you can see, she's also aspirating the air inside the vial, making it sure that there is no negative pressure anymore. And if you're going to recap your needle, make sure that you carefully do that. She's trying to recap the needle. It's because she's gonna use it again. And now she's adding another 10 cc of sterile water for injection to the vial because then again, you need to incorporate at least 20 ml or 20 cc of sterile water for injection inside the vial. And we have to make sure once it is incorporated, the powder must be dissolved or totally dissolved. And you need to carefully shake it. So as you can see in her technique right now, she's injecting the sterile water for injection, the additional 10 cc. And as you can see, there is really a negative pressure right now because you can see it in the syringe. It will really aspirate air inside the vial, which is just normal. Always be careful in terms of recapping your syringe. Make sure that you will not be pricked with it so that you won't be injured with a needle stick injury. You should be looking at in the eye level or place it in the eye level if you're going to check if all the powder is completely dissolved. And right now, we are going to withdraw the medication out in the vial. So she's introducing 10 cc of air inside the vial to make sure that it's smooth when you try to aspirate it. Be very extra careful in terms of withdrawing it because you might spill some of the medication, which it should not be. Looking at her technique, it's in the eye level. Make sure that you take off some of the air. Make sure that you have to place the 10 cc exactly in the syringe. Avoid spilling out the medication, okay? Be very extra careful then again in recapping. And there is another 10 cc that is being used to aspirate the remaining 10 cc of sterile water for injection. As you can see, same thing that she's doing right now. It's in the eye level and making it sure that it's carefully done, no spillage, and make sure that the powder is completely dissolved. And as you can see, it produces somewhat a bubbly, whitish water, no? Because the sterile water for injection and the medication are well incorporated on those certain techniques that is being done by the nurse. And of course, you have to get the bubbles, make sure that the 10 cc syringe is completely filled, and you place it in the basket or in a medication tray. No, here in our institution, we use the tray with the ticket and also the medication box or vial together with the prepared medication. As you can see right now, she is preparing the burette chamber. A very good brand name for that is Soluset, or we are using right now Terumo. No? In our hospital, we use Terumo for our infusion sets. And as you can see the technique, she is actually getting almost 50cc to 60cc incorporated plain NSS inside the burette chamber, and making it sure that the medication is well in place. She's trying to inject already the medication inside the burette chamber slowly and carefully, and making it sure that sterile technique is being observed. And by the way, guys, before she did that, you have to make sure as well na you have to ask the name as well as the birth date of the patient. That's very important. Those two identifiers, since you are giving medication, it's part of the hospital protocol for patient safety. And right now, as you can see, it's well incorporated in the burette chamber or Solu set or the Terumo infusion set. And she's just making it sure that it's well hung so that by gravity, it would just flow, no? And do not forget to open up the burette chamber by pressing the chamber, no? So you can see there that it's already dripping. That means to say that it's good to go. Usually it's given at least 1 hour.